So something I've been doing a lot in clinic recently is tractioning through the joints of the leg, so ankle, knee and hip. And I've been sending people individual videos on how to traction their own ankle, knee and hip at home, and I thought it was probably about time I made a video. So what you will need for this is something that is fairly solid, so I'm just using the end of my physio couch with the brakes on. But you could use, you know, the bottom of the banisters or something like that, but you just need space where you can sit with your leg out straight, and you need something solid to pull against, okay? And then I'm using a yoga belt, but actually any belt will do. What you need to do is to create a loop with the belt. So I'm just putting that through the D-rings, create a loop there, and then put that loop around my ankle. So I have a nice solid loop here. If you are tractioning the ankle, you want to put that really low down, close to the foot. If you're tractioning knee or hip, it's less important exactly where that goes. You then wrap your belt around your solid upright thing, so whether that's your banister or whatever, but you can see there that it's wrapped around the upright and it's wrapped around my foot. And then I'm just going to sit back a little bit so that there's a little bit of space there, and I'm going to use my upright as a pulley, and I'm just going to lean back and pull. Now, one of the important things here that I have found is that it's often useful to do some pre-stretching and or massage soft tissue work to the soft tissue around the joint that you're trying to stretch. So for example, if you're trying to traction your ankle, it's useful to have massaged and stretched your calf muscle first, because otherwise the calf attaches to the foot and to the tibia. And so if that's tight, it will restrict your ability to traction the ligaments of the joints. Same for the knee. If you're trying to traction the knee joint, it makes sense to first release the calf muscles, because they cover the knee at the back, and the hamstrings and adductors, because they cover the knee from above and down the back. So again, if you're tractioning the knee, release the calf and adductors and hamstrings first. If you're doing the hip, then you want to have a good old release, so whether that's tennis ball, massage gun, whatever, but you want to release around the glutes and hip flexors first. But then it's nice and simple. You just pull back, put your brain into the joint that you're trying to let go of. So at the moment I'm trying to traction my knee, so I'm just visualising the tibia coming away from the femur and visualising letting go and lots of space in there, and I can feel that the traction slowly, as my brain goes in there, is starting to take effect. So it doesn't need to be hard, it just needs to be enough that you can feel it and enough that you can let go. It shouldn't be painful. So if you're really yanking away at it, maybe just let go a bit. Bodies actually respond better sometimes when you're a wee bit gentler to them. And then just do some, breathing into the diaphragm, just thinking about letting everything go, and gradually you should feel that you're creating a little bit of space in the joint you're trying to traction. So that is how I'm teaching people to traction ankle, knee and hip. There you go.